You checked your blood pressure this morning. The number looked fine. Maybe 128 over 78. Maybe even 122 over 75. And you thought, good, everything is okay. But here's what your doctor may not have told you yet. That reading might not be telling you the truth. In fact, for millions of adults over 60, a blood pressure reading that looks completely normal is hiding something far more dangerous underneath. And the scary part? Most people won't find out until they're sitting in an emergency room. Today, I'm going to show you exactly why blood pressure lies, especially as we get older, and the specific signs your body gives you before things go wrong. Stay with me through this entire video, because what I'm about to share in the next few minutes could genuinely save your life. My name is Dr. Stenwood. I've been a practicing physician for over 30 years, and in all that time, one of the most common things I've seen, and one of the most heartbreaking, is a patient sitting across from me after a stroke or a cardiac event, saying, "But doctor, my blood pressure was always fine," and they believed that. They checked it regularly. They followed the guidelines. They took their medication. And yet, something still went wrong. Now, I'm not here to frighten you today. Fear doesn't help anyone. What I'm here to do is give you the information that most doctors simply don't have enough time to explain during a 10-minute office visit. Because blood pressure, especially for adults in their 50s, 60s, and 70s, is far more complicated than a single number on a screen. And once you understand why it's complicated, you'll be in a much stronger position to protect yourself. So let's begin. Let me start with a question. When was the last time your blood pressure was checked? If you're like most of my patients, you probably got it checked at your doctor's office, maybe at a pharmacy kiosk, maybe at home with a cuff you bought online, and you got a number, and that number fell somewhere in the range your doctor called acceptable. But here's the problem. A single blood pressure reading, taken at one moment, in one environment, under one set of circumstances, tells us surprisingly little about what's actually happening inside your arteries. Let me explain why. Blood pressure is not a fixed number. It changes constantly throughout the day. It rises when you're stressed. It drops when you're relaxed. It spikes when you stand up too quickly. It falls when you're lying down. It responds to what you ate, whether you've had coffee, how well you slept the night before, even whether you needed to use the bathroom when you walked into the doctor's office. This is completely normal. Your body is designed to adjust blood pressure moment to moment. That's a sign of a healthy cardiovascular system, actually. But here's where it gets complicated for people our age. As we get older, and I say we because I am in this group too, our blood vessels gradually become less flexible. The walls of our arteries stiffen. This is a natural part of aging. It happens to everyone. And when your arteries are stiffer, your blood pressure readings behave differently. They can spike higher with less provocation. They can appear more variable. They can look perfectly normal in a clinical setting, while doing something completely different at home, at night, or during periods of physical activity. This is called masked hypertension, and it is one of the most underdiagnosed conditions in adults over 60. Here's how it works. A person comes into my office. They're a little nervous, most people are, but their reading comes back 124 over 76. Normal. We both feel relieved. They go home. But what I don't see is what happens at 2 in the morning, when their blood pressure quietly climbs to 158 over 94. Or what happens during an argument with a family member, or during a stressful phone call, or during a brisk walk to the mailbox. I don't see any of that, and neither does the patient, because no one checked. According to research published in major cardiovascular journals, masked hypertension affects an estimated 1 in 7 adults with otherwise normal-appearing blood pressure readings. In people over 65, that number climbs even higher, and people with masked hypertension have nearly the same cardiovascular risk as people with consistently high blood pressure. Think about that for a moment. A normal reading at the doctor's office, combined with elevated readings at home, equals the same risk as someone we would classify as hypertensive. That's why I say blood pressure can lie to you. Not because the machine is broken, not because your doctor made a mistake, but because a single reading, taken at a single moment, simply cannot capture the full picture of what your cardiovascular system is doing 24 hours a day. Now, you might be wondering, if single readings aren't enough, what should I be doing differently? I'll get to that, but first I need to tell you about another way blood pressure misleads older adults. And this one is even more commonly missed. Here's something I want you to remember from today's video. The most dangerous time of day for your cardiovascular system is not during exercise. It's not during stress. It's not even during sleep. It is the moment you wake up. Let me explain. During sleep, your blood pressure naturally falls. This is your body resting and repairing. Blood pressure typically drops between 10 and 20% during the nighttime hours. Sleep is genuinely one of the most restorative processes your heart benefits from. But when you wake up in the morning, your body triggers a massive hormonal shift. Cortisol, your primary stress hormone, surges. Adrenaline rises. Your heart rate increases. Your blood vessels begin to constrict, and your blood pressure shoots upward, sometimes dramatically, in the space of just a few minutes. This is called the morning blood pressure surge, and in healthy young adults, this surge is modest and manageable. The cardiovascular system handles it easily. But in adults over 60, the morning surge can be extreme. Research shows that blood pressure in the early morning hours, between approximately 6 a.m. and noon, is significantly higher than at any other point in the day. And during this window, the risk of heart attack and stroke is measurably higher than at any other time. Many of my patients are shocked when I tell them this, because they check their blood pressure in the evening or in the afternoon, and it looks perfectly fine. 126/80. Comfortable. Reassuring. But if I could show them what their arteries were experiencing at 7:15 in the morning, 20 minutes after waking up. For some of them, those numbers would be alarming, and this matters enormously for medication timing too. Many people take their blood pressure medication in the evening or at bedtime, believing this is the most effective approach, and for some people, that is the right strategy. But for others, particularly those who experience the morning surge, evening medication has largely worn off by the time their arteries face their biggest daily challenge. This is not a small issue. A major study called the MAPEC study, and another large study called TIME, looked at exactly this question. Does it matter when during the day you take your blood pressure medication? The results were significant and somewhat surprising. They found that blood pressure control patterns vary enormously between individuals, and that optimizing the timing of medication, based on a person's individual blood pressure pattern, can meaningfully reduce cardiovascular events. This is not something most patients are ever told, because figuring out a person's individual blood pressure pattern requires more than a few office readings. It requires something called ambulatory blood pressure monitoring, or home monitoring done correctly over multiple days. Which brings me to the most important practical advice in today's video. And I want you to pay close attention here, because this is something you can actually act on. Many of my patients tell me they check their blood pressure at home regularly, and I appreciate that. I genuinely do. It's one of the best habits a person over 50 can develop. But when I ask them how they do it, what time of day, what position they're in, whether they've been sitting quietly beforehand, the answers are almost always inconsistent. And this matters more than most people realize, because the conditions under which you measure your blood pressure dramatically affect the reading you get. Let me walk you through the correct way to measure blood pressure at home. And I want to be honest with you. It takes a few more minutes than most people expect, but those extra minutes make your readings far more meaningful. Step 1. Sit quietly for 5 minutes before you measure. Not 3 minutes, not 1 minute. 5 full minutes. I know that sounds like a lot. But even a short walk to the bathroom, or a slightly hurried morning routine, or a brief argument with a family member, all of these can elevate your blood pressure significantly for longer than you'd expect. Sit in a chair. Both feet flat on the floor, back supported. No talking, no phone, just stillness. 5 minutes. Step 2. Use the correct arm. For most people, the non-dominant arm gives a slightly more accurate reading. And always use the same arm every time, so your readings are consistent and comparable. The cuff should sit on your bare skin, not over clothing. And it should be positioned at heart level, meaning at the same height as your chest, not hanging down by your lap. Step 3. Take 2 or 3 readings, 1 minute apart. A single reading is useful, but 2 or 3 readings taken 1 minute apart, and then averaged, give you a far more reliable picture. Blood pressure varies even minute to minute. By taking multiple readings and averaging them, you smooth out those fluctuations and get a number that actually reflects your true blood pressure at that moment. Step 4. Measure at consistent times. I recommend my patients measure first thing in the morning, before taking any medication and before eating or drinking anything except water, and then again in the evening, before dinner. 2 readings per day, morning and evening, written down with the date and time. Doing this consistently for 2 to 4 weeks gives you, and your doctor, something genuinely valuable. A pattern, a picture of what your blood pressure is doing across different times of day, across different days, and across different circumstances. That's the kind of information that can reveal masked hypertension. That can identify a morning surge. That can tell us whether your medication is working not just in the afternoon, but when it matters most. Now, about home monitors. Not all home blood pressure monitors are created equal, and this is a point worth emphasizing. The only monitors I recommend to my patients are those that have been clinically validated. This is different from simply being approved for sale. Clinical validation means the device has been tested in actual patients and proven to give accurate readings. Look for monitors validated by the British Hypertension Society, the European Society of Hypertension, or the American Medical Association validation protocols. Many pharmacies and medical supply stores carry them. Your doctor can recommend a validated device. And one more important point. Upper arm monitors are consistently more accurate than wrist monitors. Wrist monitors are convenient. I understand the appeal, but the position of your wrist relative to your heart, even slight variations in angle, can introduce meaningful errors into the reading. For health monitoring in adults over 60, upper arm monitors are strongly preferred. Now, I know some of you watching this are thinking, okay, so my readings at home might be higher than I thought. Does that automatically mean something is wrong? Not necessarily. And this is an important reassurance. There is a difference between blood pressure that is occasionally elevated due to a specific trigger, a stressful day, a poor night's sleep, too much sodium at dinner, and blood pressure that is consistently elevated across many readings, many days, many conditions. The occasional high reading is not a diagnosis. The consistent pattern of high readings is what matters, which is exactly why the habit of tracking over time is so much more valuable than any single measurement. If you find that your home readings are consistently higher than your office readings, bring that log to your doctor. Show them the pattern. Ask specifically about masked hypertension. Ask whether your current medication timing is optimized for your individual pattern. These conversations can make a real difference. And speaking of patterns, I want to tell you about something else that affects blood pressure in older adults that is almost never discussed. Something that might be happening to your body right now, and that you may have completely attributed to something else. Many of my patients, and I mean people I've known for years, people I genuinely care about, come to me describing symptoms that they've quietly accepted as just part of getting older. Morning headaches that go away after an hour or so, a slight feeling of pressure behind the eyes, brief moments of dizziness when standing up, feeling off in the mornings in a way they can't quite describe. And they've accepted these things because they're not dramatic. They come and go, and everyone around them seems to be having similar complaints. But I want to gently challenge something today. Not every symptom of aging is just aging. Some of the things we dismiss as inevitable changes are actually our body's way of communicating that something in our cardiovascular system needs attention. Let me go through some of the patterns that are genuinely worth paying attention to. Morning headaches. A headache that is present when you wake up, particularly at the back of the head or in the temples, and that fades after an hour or two of being up and about, is one of the classic overlooked signs of elevated nocturnal or morning blood pressure. Now, morning headaches have many causes. Poor sleep, dehydration, tension, grinding your teeth at night. These are all common and relatively benign. But if you regularly wake up with headaches and your blood pressure has never been carefully evaluated across multiple times of day, including the morning, it's worth discussing with your doctor. Waking headaches combined with consistently elevated morning blood pressure readings is a pattern that deserves medical attention. Dizziness when standing. This one is slightly different, and it's important to distinguish between two separate issues. The first is called orthostatic hypotension. This is when your blood pressure drops suddenly when you stand up, causing dizziness or lightheadedness. This happens because as we age, our blood vessels are slower to adjust to positional changes. This is a relatively common phenomenon in adults over 65. And while it's generally not dangerous in mild cases, frequent or severe orthostatic hypotension significantly increases the risk of falls, which, as many of you know, are one of the most serious health concerns for adults in this age group. If you regularly feel dizzy or lightheaded when you stand up, this is something to monitor and discuss with your doctor. Simple strategies, like sitting on the edge of the bed for 30 seconds before standing, staying well hydrated, and reviewing your medications, can make a meaningful difference. The second type of dizziness is different. Brief episodes of spinning, unsteadiness, or feeling like the world is tilting, particularly if accompanied by any visual disturbance, sudden weakness, or difficulty speaking, warrant immediate medical evaluation. These are potential warning signs of transient ischemic attacks, which are small temporary interruptions of blood flow to the brain. And while they resolve quickly, they are serious warning signals that must not be ignored. Nosebleeds. Many people associate frequent nosebleeds with blood pressure problems. And while the relationship is sometimes overstated, recurrent nosebleeds in adults who do not normally experience them can occasionally be associated with significantly elevated blood pressure. If you are experiencing frequent unexplained nosebleeds, it's worth checking your blood pressure and mentioning it to your doctor. Visual changes. Blurring or changes in vision, particularly if they come on suddenly, can sometimes be related to blood pressure fluctuations, especially in adults who have had consistently elevated levels over a long period. Chronic high blood pressure can affect the small blood vessels in the retina. Sudden visual changes should always be evaluated promptly. Fatigue that doesn't make sense. Many adults over 60 accept fatigue as inevitable, and some fatigue is completely normal with age. But fatigue that is disproportionate, that limits activities you could easily manage a year or two ago, can sometimes be related to cardiovascular strain. When the heart is working harder than it should against elevated blood pressure over a long period, it can cause a gradual increase in fatigue that is easy to attribute to simply getting older. I don't say this to alarm you. I say this because dismissing fatigue as inevitable without ever checking whether cardiovascular factors might be contributing is a missed opportunity for early intervention. Now, I want to be clear about something important. None of these symptoms alone is proof of a blood pressure problem. Headaches have many causes. Dizziness has many causes. Fatigue certainly has many causes. But a combination of these symptoms, combined with blood pressure readings that show variability or consistent morning elevation, is a pattern worth taking seriously. And this is exactly the kind of conversation I encourage you to have with your own doctor. Don't walk in and say, "I've been tired lately." Walk in with your blood pressure log, with your pattern of morning readings, with a description of specific symptoms and when they occur. That's the kind of information that allows doctors to actually help you. Before I close today's video, I want to spend a few minutes on something that I think is genuinely hopeful. Because while the picture I've painted today might feel a little unsettling, the truth is that blood pressure, even in adults over 60D, responds remarkably well to specific lifestyle changes. Not miracle cures, not expensive supplements, not dramatic interventions, simple, consistent habits that are fully within your control. Let me share the ones that I discuss most often with my patients in this age group. Sodium, but not in the way you might expect. Most people know that reducing sodium can help lower blood pressure. But here's something fewer people realize. As we age, we become significantly more salt-sensitive. This means that the same amount of sodium that had little effect on blood pressure at age 40 can have a noticeably larger effect at age 65. This is partly because aging kidneys are less efficient at excreting sodium, and partly because aging blood vessels are stiffer and respond more dramatically to fluid volume changes. The practical implication is this: if you are over 60 and your blood pressure has been creeping upward over the past few years, sodium is one of the first places worth investigating, even if you think your diet is reasonably healthy. The hidden sodium problem is processed foods, not the salt shaker on your table. Restaurant meals, packaged soups, deli meats, canned foods, bread, cheese. Even foods that don't taste particularly salty can be remarkably high in sodium. I always recommend my patients keep a simple food log for a week, not counting calories, just noting what they eat, and then look at the sodium content of their most frequent foods. The results are often surprising. Aiming for less than 1,500 milligrams of sodium per day is a reasonable target for most adults over 60 with blood pressure concerns. Your doctor can give you a personalized recommendation. Potassium, the other side of the equation. For every conversation about reducing sodium, there should be an equal conversation about increasing potassium. Potassium and sodium work in opposition inside your body. Potassium helps your kidneys excrete sodium, it helps relax blood vessel walls, and it is consistently associated with lower blood pressure in research studies. Many older adults are actually mildly potassium deficient, partly because of diet and partly because some commonly prescribed medications, including certain diuretics, deplete potassium over time. Good food sources of potassium include bananas, sweet potatoes, avocados, leafy greens, beans, and lentils. However, and this is important, if you have kidney disease, or if you are on certain medications that affect potassium levels, increasing potassium without medical guidance can be harmful. Please discuss this with your doctor before making significant dietary changes. Physical activity, and why walking matters more than you think. I'm not going to tell you that you need to start running marathons. What I am going to tell you is that consistent, moderate physical activity, particularly walking, has a genuinely powerful effect on blood pressure in older adults. Regular walking improves the elasticity of blood vessels, It reduces arterial stiffness, that age-related change I mentioned earlier that makes blood pressure more volatile. It helps regulate weight. It reduces stress hormones. And it has direct positive effects on the kidney's ability to regulate fluid balance. In multiple studies, a regular walking program of 30 minutes a day, 5 days a week, has produced reductions in systolic blood pressure comparable to the effect of some blood pressure medications. That's remarkable. And it costs nothing. If 30 minutes feels like too much to start with, begin with 10 or 15. The key is consistency. A short walk every day is far more beneficial than an occasional longer one. One practical tip: walking in the morning, before the day gets away from you, helps establish the habit more reliably. And for people with a morning blood pressure surge, evidence suggests that moderate morning exercise may actually help moderate that surge over time. Sleep, the underestimated blood pressure regulator. Earlier, I mentioned that blood pressure naturally falls during sleep. This is called nocturnal dipping, and it is associated with better cardiovascular outcomes. But in adults who sleep poorly, whether due to insomnia, sleep apnea, frequent night waking, or simply not getting enough hours, this nocturnal dip is reduced or absent. This means the cardiovascular system doesn't get its nightly period of reduced pressure. And over time, this contributes to higher baseline blood pressure, greater morning surges, and increased cardiovascular risk. Sleep apnea, in particular, a condition where breathing repeatedly stops and starts during sleep, is powerfully associated with high blood pressure in older adults. And it is dramatically underdiagnosed. If you snore loudly, if your partner has noticed you stopping breathing during sleep, if you wake up feeling unrefreshed despite a full night in bed, or if you feel excessively sleepy during the day, please discuss the possibility of sleep apnea with your doctor. A sleep study can diagnose it, and effective treatment with CPAP therapy has been shown to meaningfully reduce blood pressure in people with the condition. Stress, and the chronic kind you may not even notice anymore. Acute stress, a sudden scare, a difficult phone call, causes a temporary spike in blood pressure. We all understand that. But chronic background stress, the kind that many adults in their 50s and 60s carry quietly, related to family responsibilities, financial pressures, health concerns, or simply the accumulated weight of life, produces sustained elevation of stress hormones that keep blood pressure higher on a more permanent basis. Many of my patients have been carrying this kind of stress for so long that they no longer even recognize it as stress. It has become their baseline. Simple, consistent practices that activate the parasympathetic nervous system, the body's relaxation response, have measurable effects on blood pressure over time. These include diaphragmatic breathing exercises, gentle yoga, meditation, time in nature, and regular social connection. I'm not dismissing these as soft suggestions. The research on stress reduction and blood pressure is genuinely robust. If I had to choose one place to start, I would say this: spend 10 minutes each morning, before you do anything else, simply breathing slowly and quietly. Inhale for 4 counts. Exhale for 6 counts. This activates your vagal tone, the neural pathway that tells your body to calm down, and over time, this practice has been shown to meaningfully reduce resting blood pressure. 10 minutes, every morning, before you check your phone. It sounds almost too simple, but simple things done consistently are what actually change health outcomes. Let me bring everything together for you now. Today, we talked about something that I genuinely believe more adults over 60 deserve to understand. Blood pressure is not just a number. A single reading in a doctor's office is useful, but it captures only one moment in a cardiovascular system that is constantly changing. Masked hypertension is real. The morning surge is real. The gap between what your blood pressure looks like at the doctor's office and what it's actually doing throughout your day is real. And none of this means something is terribly wrong. It means that understanding your blood pressure more completely gives you a much stronger foundation for protecting your health. Here are the key actions I want you to take away from today. First, if you don't already have a validated upper arm blood pressure monitor at home, get one. Ask your doctor which one they recommend. Second, start tracking your blood pressure consistently, morning and evening, sitting quietly for 5 minutes before measuring. 2 to 3 readings each time. Write it down. Third, pay particular attention to your morning readings. If they are consistently higher than your evening or office readings, bring that pattern to your doctor. Fourth, do not dismiss symptoms like morning headaches, unexplained fatigue, or dizziness when standing as simply getting older. Mention them to your doctor, especially in the context of your blood pressure pattern. Fifth, consider the lifestyle factors that are within your control: sodium, potassium-rich foods, consistent walking, quality sleep, and daily stress reduction. These are not trivial suggestions. They are genuinely powerful tools. And finally, please do not manage blood pressure changes on your own without medical guidance. Everything I've shared today is meant to help you have a better, more informed conversation with your own physician, not to replace that conversation. You deserve to understand what's happening in your own body, and I hope today's video has given you some of that understanding. Now, I'd love to hear from you. Did anything in today's video surprise you? Perhaps it was the morning surge, something you'd never heard of before. Or maybe it was the idea that a normal office reading might not be telling the whole story. Leave a comment below and let me know. I read every single one, and your questions and stories genuinely influence what I cover next. And if someone you care about, a spouse, a sibling, a close friend, is in their 50s or 60s and has ever had concerns about their blood pressure, please share this video with them. Not because I want more views, but because this information could genuinely make a difference for someone you love. If you found this helpful, please give it a thumbs up. It helps this channel reach more people who need this kind of honest, practical health information. And I'll see you in the next video, where we'll be talking about something that affects the heart health of most adults over 65 and that almost no one is talking about yet. Take good care of yourself. I mean that. Dr. Stenwood.